how can we properly take care of an already disadvantaged population amidst a pandemic if we cannot properly take care of ourselves? My trust was affected in the healthcare system at the time, especially since I ended up in the ICU and was very close to being intubated. And things are better now, but we must focus on maintaining these changes in transparency in order to solidify this trust that we have between our providers, patients, and administration and the healthcare system in general, well before the situation worsens.
Elderly woman of color who was disadvantaged financially had survived her prolonged hospital stay with COVID-19. Unfortunately, she came back to my emergency department and I saw her 2 days after her hospital discharge. The ambulance brought her because her outpatient dialysis had not appropriately been coordinated and rescheduled after leaving the hospital. Her trust in our system to help facilitate the care that she required in order to breathe and live healthy had failed her. And thus her trust was gone in our system's ability to provide for her what she needed. Now, I hope we can build a system that can provide health care equitably to those who need it and at the time when they need it. Then we will have a system that's trustworthy.
One of the greatest challenges we've faced during the pandemic is understanding the most effective treatments for patients. And the word experiment has a strong connotation in the African American community of performing research without regard for the subject's safety or well-being. Scientific objectivity in conducting studies isn't conducive to the establishment of trust. On the individual doctor-patient level, trust is manifest by the kindness and compassion we demonstrate to every one of our patients. But on an institutional level, it manifests as just and equitable care.
Our hospital disproportionately serves low-income patients, including many patients experiencing homelessness. As we expected, our hospital surged quickly. We found ourselves chasing space, staff, and personal protective equipment. The shelters face some of the most difficult challenges. Think vulnerable population in very close quarters during a pandemic. Hospitals in Boston had limited PPE at the time. The shelters had none.
Access, education, support. These are three things that we often take for granted. And what do they all have in common? Health. Many vulnerable populations don't always have access, have the knowledge, or have the support. And then add COVID-19 into the mix. Three things that can change an entire person's life and illness experience for the better or worse.